We all know pregnancy is rough on our bodies. Rapid weight gain, stretch marks, and loose skin no amount of exercise can cure. It's so frustrating. A tummy tuck can repair muscle elasticity and flatten your belly to its pre-baby look. Dr. Robery Sigal will explain the best timing and available procedures to address that postpartum tummy so you can focus on your family and your life, not your belly.
Pregnancy can be really rough on a woman's body. The body doesn't tolerate rapid weight gain as well as it tolerates weight gain slowly over time. Then there's the stretching of the muscles. The stretching of the muscles is on a radius, and you're talking primarily about these muscles here, the rectus muscles, and the gap between them becomes wider as the stomach blows up, and it never quite comes back to where it had started. It comes back kind of here as opposed to tight to the midline, and so part of a tummy tuck is often a repair of the muscles to bring them sort of back to where they started from. The reality is you can't fix these things, right? I mean, you can't fix the muscles. They're not going to come back on their own, and the skin that's hanging is never going to really go away unless we take it away. We use that scar as part of our tummy tuck. So if the C-section scar is, let's say, that long, what we do is we come right underneath it and remove that scar, fixing it. Many times those C-section scars are a little bit overlapped, so we can make it so that it all comes nicely into line. And then we extend that C-section scar kind of like from here, maybe put about that much on that side, that much on the other side, trying to keep it low so that it hides in a bathing suit or in underwear. There is no hard and fast number, but if I was going to pick a number, I would say 3 to 6 months. What you're looking for really is you've lost your baby weight, you're healthy, you're not really lactating very much anymore, and you're not breastfeeding. And if we do that surgery while you're still, sort of heavy with pregnancy weight, we're not going to be able to tailor the tummy tuck as cleanly and as perfectly as we could. You don't want to be doing this with your weight, up and down and up and down, and you don't want to be doing this with your weight, which is sort of gaining. Because what happens is if you do the tummy tuck here, or any really big body surgery, anything with even liposuction, right, and you gain weight afterwards, you can eat faster than we can suck. So what you really want to be doing is this surgery at a stable weight. It doesn't matter if it's, a high stable weight, but you want to be at a stable weight so that your result is going to be maintainable.
Click the link in the description below to read our blog post on this subject. You can also schedule a consultation with one of our specialists through our online forum, or browse the before and after galleries to see our patients' amazing results.